Good afternoon, and first I would like to thank the organizing committee for the opportunity to present the results of this study. Here are some disclosures. Mucosal healing has become an important part of treating IBD patients and monitoring disease activity. In ulcerative colitis, we know that mucosal healing reduces the risk of relapse. It also reduces the risk of treatment escalation, and it also reduces the risk of colectomy. Therefore, endoscopic examination of the colonic mucosa after treatment for active disease to assess the healing process is now generally recommended, but still not fully implemented in standard care. We know from a few other studies that even if endoscopic healing is achieved, a small proportion of the patients still have histological acute active inflammation in the colonic mucosa. It has also been shown that these patients have an increased risk of relapse compared to those without histological inflammation. In this prospective cross-sectional study, we included 76 patients comprising both active and inactive ulcerative colitis. All patients underwent sigmoidoscopy with rectal biopsies. The endoscopic appearance was assessed using two different score systems, the well-known Mayo endoscopic score and the recently developed ulcerative colitis endoscopic index of severity. Using Mayo endoscopic score, inflammation is divided into 4 categories of increasing severity. The value 0 corresponds to normal or absent inflammation, and the values 1 to 3 corresponds to mild, moderate, or severe activity. As we heard before, most studies defined mucosal healing as Mayo endoscopic score 0 or 1. In this study, we have chosen to define mucosal healing as 0. UCEIS is a composite score that evaluates 3 different components of the inflammation: the vascular pattern, the bleeding, and the presence of erosions or ulcers. Within each of these 3 categories, a value is assigned, and these values are summed to a total score between 3 and 11, or according to the new published validation study, between 0 and 8. There's no international accepted definition of mucosal healing using UCEIS, and in this study we have chosen the lowest possible value of 3 to define mucosal healing. Sections of tissue samples were evaluated by 2 individual blinded pathologists using a newly developed scoring system that assessed the degree of acute inflammation on the basis of 3 factors: the extent of cryptitis, the extent of crypt abscesses, and the presence of erosions or ulcers. On this basis, the inflammation is divided in 4 groups ranging from 0 to 3. 0 corresponds to absence of inflammation, and 1 to 3 corresponds to mild, moderate, or severe inflammation. And this is a non-additive score. As I said, 76 patients were prospectively enrolled in this study. The median age was 38 years, 58% were female, and the median disease duration was 5 years. Approximately 60% of the patients had endoscopic active disease, 33% had proctitis, 22% had proctosigmoiditis, and 44% had left-sided colitis or pancolitis. We used the gamma test to analyze the data. The gamma test is a measure of rank correlation, and it measures the strength of association of cross-tabulated data when both variables are measured at the ordinal level. The values range from -1 to 1, and a value of 0 indicates the absence of association. And in this slide, you can see the comparison of the 2 endoscopic score systems, the Mayo endoscopic score and the recently developed UCEIS. We found a significant gamma value of 0.99. A strong association between these scores was indicated. Next, we compared the degree of histological inflammation with the endoscopic view, evaluated with both endoscopic score systems. The comparison between the Mayo endoscopic score and the histological inflammation revealed a significant gamma value of 0.83. The same was true when we compared UC-EIS with the histological inflammation, where we found a significant gamma value of 0.76. It is important to note that when we use the Mayo endoscopic score to assess mucosal healing, 90% of the patients had histological inflammation despite endoscopic mucosal healing. The same was true when we used UC-EIS to assess mucosal healing. In patients with UC-EIS value of 3, 15% of the patients had histological inflammation. In all cases, the histological inflammation was mild. In summary, we found a strong association between the well-known and widespread Mayo endoscopic score and the newly developed ulcerative colitis endoscopic index of severity. In this group, we consider UC-EIS as a simple and promising score system due to its composition of 3 different inflammatory measures with well-defined subdivisions. This makes it quick to learn and easy to use, and in this setting, it seems to be just as accurate as Mayo endoscopic score. Both endoscopic score system had significant associations with the histological grade of inflammation. Moreover, we found mild histological inflammation in 15 to 19% of the patients with endoscopic mucosal healing. If this represents residual inflammation from recent active endoscopic disease, or if it's associated with certain kind of medications, or if these patients represent a particular subgroup is still unknown. Previous studies have shown equally high rates of physiological inflammation in endoscopic inactive disease. Furthermore, as was shown before, these patients seem to have a significantly higher rate of relapse during the first year, and future studies will provide us answers to the question whether the patients with histological inflammation, despite endoscopic mucosal healing, on the long term have a worse disease prognosis. If that is the case, endoscopic assessment of mucosal healing, regardless of whether endoscopic score system to be used, must include biopsies to detect histological inflammation. If optimization of the medical treatment in these patients can reduce the histological inflammation and possibly the higher relapse rates is unknown, and the role of fecal calprotectin to identify these patients needs to be solved. Thank you.